the fuss in Canberra yesterday, a huge report was handed down on the dental health of millions of Australians, and it's too important to be buried by all the argy-bargy from Parliament.
Steve Buscemi, great actor, bad teeth. That's why he's cast as a villain or nutbag. Anne Hathaway, great actor, great, huge teeth. Always cast as a likeable sweetheart. So what can we deduce from this?
Teeth are actually the most important thing in the world.
But if someone's got revolting teeth, then it's pretty off-putting. A good smile makes a great face.
I wouldn't kiss someone with bad teeth. It's disgusting.
I would never, ever kiss anyone with bad teeth. Ever.
But vanity and pashing aside, what lies beneath? Millions of Australians suffer from poor dental health, and evidence shows having a bad set of chompers can increase the risk of heart disease, stroke, diabetes, even kidney failure. It's nothing to smile about.
In general practice, about 1 in 10 visits are because people have got poor dental health and they can't afford to see a dentist.
The government report shows $10 billion needs to be pumped into the system to make sure every child and low-income earner has access to basic dental care. The Greens have gone some way by securing $165 million as part of the private health deal, but that's still not enough.
Going to see a dentist should be just like going to see a doctor. There's no reason that we should treat the mouth separately from the rest of the body.
Let's face it, no one really likes going to the dentist, especially ones like this.
You know that I like to fool around.
Okay, maybe I would. In fact, I'm booked in for next Thursday. So far from just looking good, having healthy teeth could save your life.
Steve Hamilton is the president of the AMA and joins us. Steve, it's pretty shocking to think that having bad teeth could actually shorten your life expectancy. But for those of us that aren't doctors, how does having bad teeth equate to something like a stroke?
Well, it certainly does have an impact, and we've got to remember that inside our mouth we can carry enormous numbers of germs. If we don't actually clean our teeth properly, that dental caries, those germs, can sit around the gums and they can spread through the bloodstream, and they can increase risks of stroke, risks of heart attack, risks of lung disease.
Well, Dr. Hamilton, we know that dentists would like it included in Medicare because it means they're going to make more money out of it. But is it purely historical that the mouth was left out when Medicare was designed?
Well, it does seem to be historical, and certainly federal government's been blaming the state government for not investing. State government's been pointing the finger at the federal government. It's another one of these blame games. But I'd certainly caution the dentists to say be careful what you wish for, because Medicare has been one of the most effective tools to actually keep the price down.
Where does personal responsibility come in? I mean, we all start with a perfect set of teeth, and yes, we have dental decline, but it's not expensive to buy a toothbrush and some toothpaste, is it?
Well, it's not, and I think that we do need to improve the health literacy and the dental literacy, I guess, of our population. For young children, we see too many of those deciduous teeth, those baby teeth, being extracted, and awful stories with dental decay. And of course, in adulthood, we see serious disease and even impairment in things like pregnancy, premature births, all sorts of things that bad teeth can impact on.
Maybe one less mobile phone, one less flat screen TV, and a couple more visits to the dentist might help a few people.
Hold on. You don't exactly have perfect teeth. Have you looked in the mirror
Nothing
recently?
wrong with my teeth.
Steve, the big problem here with this policy is the fact that it's going to cost $10+ billion. But is there a chance this could actually save the government and the Australian taxpayer money over time?
Well, look, there's no doubt this will save money over time. It will pay itself off. It won't pay itself off in the short term, though. It'll be another government or a couple of governments away where this chronic disease decrease the impact will be felt. So it's very hard for governments to invest in that long-term gain, but they really should.
Doc, with the state of my teeth, according to this report, I should already be dead. Am I a medical miracle?
Well, there's nothing a toothbrush and a couple of visits to a dentist won't fix, so I think that's probably the first place to start.
Well, Steve, it's been great to have you on tonight. Thanks so much for your time.
Thank you very much.
The point I was trying to make